Okay, so let's talk about the public hospitals in the Indian state of Meghalaya. Because what's happening there is, well, a tale of two very different worlds. For a tiny group of people, it's all about premium, top-tier care. But for literally everyone else, it's a daily struggle just to get the basics. We're going to break down an analysis that gives this situation a very, very powerful name. So, let's dive in.
And this, right here, is the issue laid bare. Look at the contrast. And it's not just about comfort, air conditioning versus a basic fan. We're talking about a massive difference in the actual standard of care. On one side, you've got private bathrooms and premium furniture. On the other, you have a lack of emergency care and medicines that are just unavailable. These are two completely different worlds inside the same public system.
So, how does the source material actually describe the situation? I mean, it doesn't just call it inequality. No, it uses a much stronger, much more intentional term to define this system of disparity.
Healthcare apartheid. Yeah, it's a really provocative term, and it's used very deliberately here. The analysis defines it as a system where a privileged few get this lavish, high-end treatment, while the vast majority of people are left with facilities that are dangerously under-equipped. So the argument isn't just that there's a lack of resources, but that there's an active, segregated system of care.
And according to this analysis, this goes way beyond just poor management. It's seen as a symbol of a complete breakdown in the relationship between the state and its people, a sign that the government's basic responsibility to provide essential services for everyone has been abandoned.
So, what happens when a system gets this broken? Well, these aren't just abstract policy failures we're talking about. As we're about to see, they have a tragic and very real human cost. These are failures that become personal tragedies.
Which leads us to a really critical question. With the healthcare system divided like this, what's the actual on-the-ground impact on the most vulnerable people? For example, how does this affect mothers who are trying to give birth safely in the state?
And the data? Well, it's pretty stark. What you're looking at here is the maternal mortality ratio, or MMR. And you can see Meghalaya's rate is significantly higher than India's national average. A gap like this, it's a huge red flag. It points directly to a major systemic failure in delivering healthcare to women.
And let's be really clear about this. The source argues that these are preventable deaths. These aren't unavoidable tragedies. They're being directly linked to the lack of basic emergency care for poor women during childbirth, the exact kind of care that's missing from those under-equipped general wards we just talked about.
Okay, so why is this happening? To get to the root of the problem, the analysis starts to follow the money, to see exactly where the resources are going, and maybe more importantly, where they are not.
Let's take a very specific life-or-death example. Ambulances. They're absolutely critical in an emergency. They're the link that gets you to the hospital. So why are they so often out of service right when people need them the most?
Well, the reasons that are cited are just incredibly basic and frustrating. They don't have fuel. Staff just aren't there. There's no money for maintenance. The analysis concludes this isn't just a series of accidents. It's a clear sign that emergency response is simply not being treated as a genuine priority.
And this brings us right back to the central trade-off that the source is highlighting. The argument is that the money spent on these lavish VIP facilities isn't just about comfort. It's coming from the same pot of money that could be buying fuel for ambulances, stocking medicines, and actually saving lives.
But this analysis isn't just about pointing out all the problems. The source material is also focused on what can be done about it. It actually provides a clear roadmap for how citizens can start pushing for accountability and demand real change.
And here is that roadmap. It's a 4-step strategy. First up, demand that those exclusive VIP wards get converted into emergency and ICU facilities that are open to everyone. Second, push for mandatory staffing at health centers with real consequences for absenteeism. Third, support community health committees so they can act as local watchdogs. And finally, use the legal system, file public interest litigations to force the government to allocate resources more equitably.
In the end, the entire argument really hinges on this one powerful statement from the source material. Each preventable death represents a failure of the healthcare system. It's just a stark reminder of the very real, human cost of these failures.
Which leaves us with the one big question at the heart of this entire analysis. When a public hospital, funded by taxpayer money, creates two completely separate and unequal systems of care under one roof, who does it truly serve?